Hi, my name is Maddie Brandt,
And my name is Claire Kelly.
and today we're going to be talking about the United Nations Sustainability Goal of Global Health and Well-being.
Here's our table of contents. So today we'll be talking about defining the initiative in a general context, explaining how the goal addresses a deeper global challenge, explaining how it addresses this challenge in our community, country, region, the action to accomplish this goal, challenges of the goal, and relevance of the issue.
So, to define this issue, it can be defined as guarantee the availability of health services and promote the well-being for everyone. And here's a little graphic to briefly describe the objectives of the goal, and we will discuss it more in detail on the next slide.
So there are 13 global health targets that will help to create measurable goals for which people can strive for. These goals are meant to create action in communities, and they've made specific progress in the past. For example, over the last 15 years, childhood deaths have halved. This is a result of the constant improvements in the world and within specific communities and fighting for the health and well-being of everyone. So here are the goals. It's reduce maternal mortality, end all preventable deaths under 5 years of age, fight communicable diseases, reduce mortality from non-communicable diseases, and promote mental health, prevent and treat substance abuse, reduce road injuries and deaths. Universal access to sexual and reproductive care, family planning, and education, achieve universal health coverage, reduce illnesses and deaths from hazardous chemicals and pollution, implement the WHO Framework Convention on Tobacco Control. The last ones are support research, development, and universal access to affordable vaccines and medicine, increase health financing and support health workforce in developing countries, and improve early warning signs for global health risks.
So, next, we're going to talk about how this objective has been found in action in our communities in our country. So the issues within Delaware and the rest of the United States are similar, but they're also very different. For example, in 2021, there were 450 opioid dose deaths in Delaware, which accounted for 88% of all drug overdose deaths in the state. Across the US, opioid overdose deaths accounted for 75% of all drug overdose deaths in the country. Another serious lack of perfection of good health and well-being within Delaware and the US is motor vehicle crashes. Delaware has seen a 16% decrease, but still with 137 fatalities in 2023 compared to 164 in 2022, showing that the goal is working. And lastly, healthcare is beginning to look favorable, with about 92% of Delaware's population ages 19 to 64 had healthcare coverage in 2018 compared to an 87% national average.
So the initiatives have been the United States has developed the Healthy People 2030, which redefines the definition of health and well-being and define it by how we think, feel, and function. They also define it by how these things affect them as a whole and how it affects the meaning of people's lives. It also talks about how across different families, neighborhoods, communities, and other organizations, that can strongly influence our health and well-being, and to try and make improvements based off global health and well-being global goals in those. So for the action, they've found that health involves both physical and mental well-being, and staying fit despite changes in circumstances like worsening environment. Well-being, on the other hand, is shaped by health and includes both objective and subjective factors like physical, mental, emotional, social, well-being, and etc. To improve the long-term quality of life requires resources like stable housing, healthy food, clean air, good education, well-paying jobs, and in the short term, immediate support is needed, including healthcare, food assistance, etc. And achieving optimal health and well-being requires cooperation from various sectors at different levels, like the state, local, or community efforts to address real life circumstances that are affecting people's health. These are the different healthy people goals, and it just kind of shows the changes that have been made over the last few decades. So these are the obstacles, and this just kind of shows the 10 causes of the causes. of poor health, which is like psychological influences. And it just kind of shows that we need to strengthen the capacity of our communities to work together because cooperation is needed to solve the issues.
And lastly, the importance of this issue can be found in so many different ways. Improving the global health and well-being would contribute to the improved lives of everyone around the world. It would hopefully lead to a decrease in the number and spread of diseases through the expansion of accessibility to vaccines and other preventative measures. Giving everyone the same opportunities to basic necessities such as clean water and a healthy diet would improve so many lives. While this issue is so broad and helps so many people in different ways, it is a way for us all to come together and make a global impact that benefits us all. And here are our sources. Thank you.
Thank you.
Bye.
Bye.